Teresa Schwartz is with us. She's a surgery professor at St. Louis University School of Medicine and back on the show by popular demand. Good morning, Dr. Schwartz.
Good morning.
All right, so Angelina Jolie has been in the news quite a bit because she had a mastectomy, a double mastectomy, and now she just had her ovaries removed because she was diagnosed as having the What? Why did she do this?
She actually has a genetic mutation. So she had a family history of ovarian cancer. I believe her mom passed away at a pretty early age. And then she underwent genetic testing and was found to have a certain mutation that puts her at a tremendous risk of getting both breast and ovarian cancer. So it put her at approximately 50 to 80% lifetime risk of breast cancer and about a 50 to 60% risk of ovarian. So her operations were really risk reduction maneuvers.
And so how common is that? When you hear it, it sounds pretty extraordinary, but are more and more women opting to do this?
No, after she came forward and said that she had the genetic mutation and was getting the operations, women weren't lining up to get additional operations that they didn't need. What it did do, this Angelina effect that they discuss, is that it opened up a line of communication between patients and their physicians. So people were going in and saying, hey, I've got this extensive family history, or I have this personal history. Do I qualify for testing? And then once there were more tests done, more discussions held, then the operations that were being done were all perfectly appropriate. It wasn't that anyone was getting something that they didn't necessarily need or would otherwise be recommended.
So what do you tell women who come in and say, hey, should I have this test done to see if I am one of these candidates?
There's very strict criteria on who would actually benefit from genetic testing. There's not a lot of women that actually qualify. And in fact, just in the United States, about 5% of our breast cancers are hereditary. The rest of them, 95%, are spontaneous.
You said 5%?
5%.
Just 5?
Mm-hmm. So it's a very low number of women who have a genetic mutation that actually have breast cancer diagnosis as well. Most women, it's just a spontaneous reason that they got breast cancer. So once someone is diagnosed, you actually go through their whole family history, go through their whole personal history, and see if you can pluck out any red flags that would prompt you to think testing would be helpful.
So you can tell, science can tell if you got the breast cancer genetically or if you got it from some other reason?
Well, sort of. If you have a breast cancer diagnosis, then you can be tested to see if you have an error in your genes that doesn't allow you to fix mistakes easily.
Right.
Now, whether or not that exactly caused the breast cancer, we can't perfectly prove, but it does put you at a tremendous risk of getting it in the future.
How invasive is this test? Is this
a blood test or a saliva test, so it's not invasive at all. It is quite expensive, so if you don't qualify or if you don't meet criteria for it, then you're going to be paying thousands of dollars out of pocket.
Which is the next question. Now, St. Louis University Hospital does this testing for free?
Well, at least the genetic counseling for free. So our genetics counselor is nationally renowned. She's absolutely fantastic. And all of our genetics evaluation and counseling is free of charge for any person that comes into the SLU Cancer Center. The genetic testing after that, we can figure out ways to either get that covered by Komen grant funding or be able to go through their insurance companies to get it covered.
So basically, if you do the counseling first, that kind of narrows it down as to whether you should really do the testing.
Absolutely. I don't think the testing should be done without counseling because you need to have a discussion with someone ahead of time to know what your risks actually are and what you should be tested for. And then it also helps you understand when the results come back because it's confusing. It's a whole bunch of alphabet soup gene mutations and nobody would know what to do with those.
Is it medical counseling or is it mental counseling? Because mentally you have to put yourself in a spot to find out these test results.
No, absolutely. And that's one of the benefits of what Angelina Jolie did. I think it took away some of the stigma or some of the fears, so women weren't as afraid to talk to their physicians about it to see if testing would be appropriate. Whereas before, kind of ignorance is bliss. What you don't know doesn't hurt you.
So this is interesting. This Susan G. Komen grants and the money raised by the Susan G. Komen race here in town, they always talk about what it does here in town. This is one of the things it does, is it helps pay for this testing.
Absolutely, and all of the counseling that goes along with it. And one of the benefits of the Komen St. Louis Foundation is 100% of the proceeds of anything that they raise in the city stays in the city. So it's the 100% return.
And the Susan G. Komen Race for the Cure is coming up here.
June 13th, so 39 days from now.
And St. Louis University has a team, don't you?
We do, St. Louis University Cancer Center.
And so anybody can sign up and
Absolutely.
be part of that team.
Absolutely, and it does give you access, if you're on the SLU Cancer Center team, it gives you access to our Midtown Village, which is right at Chaffetz Arena, kind of in the middle of the action. You get a shuttle to the front of the race line. There's free restrooms, there's refreshments. It's kind of a nice setup right in the middle of the race.
How do people sign up for the team?
You can just go to the website, website. It's slucare.edu/Komen.
And for all this genetic testing, you can go there as well?
Absolutely. Actually, just going through our cancer center at Suzanne Mahon is our fantastic genetics counselor. And she can be seen in either our St. Louis University Cancer Center website or by calling, it's 577-8854. And then she would be able to discuss with you risks, benefits, needs for getting genetic counseling and potentially testing.
Dr. Teresa Schwartz, great information. Thanks for coming in.
Thanks.
You got it. 7:58. Tim.